Most people over 65 are told the same thing. Morning stiffness is just arthritis. It is just age. Keep moving and it will loosen up. It sounds sensible. It sounds safe. But here is what nobody tells you. Keeping moving on its own does not protect your hands, your shoulders, or your independence because it never asks the one question that actually matters. How long does the stiffness last? 30 minutes is the line. Rheumatologists have taught it for decades. Stiffness from wear and tear usually eases within about 30 minutes of getting up, while stiffness driven by inflammation drags on for an hour, for 2 hours, sometimes for the whole morning. And in the classification criteria that rheumatologists use for polymyalgia rheumatica, a condition whose peak age is 70 to 80, which is to say the people watching this, morning stiffness lasting more than 45 minutes is one of the scored items. So today I am giving you 5 things that change morning stiffness, counting down from the smallest to the largest. And I am giving you the one piece of information a 12-minute appointment almost never has room to explain: what the length of your stiffness is actually telling your doctor. The number 1 item on this list is something almost nobody talks about. Stay with me until the end because that one can change how you approach the next 10 years. Here is why you have probably never heard this. The average appointment runs about 12 minutes. In 12 minutes, your doctor has to review your medications, check your blood pressure, read whatever is on the screen, and deal with the reason you booked. When you say my hands are stiff in the morning, that is one line in a 12-minute conversation. It sounds like a complaint about comfort, so it gets answered like one: try some heat, keep moving, take something for it. Nobody has 90 spare seconds to ask the follow-up question that turns that complaint into evidence. How long exactly, measured against a clock? I want to be clear about something before we go further. I am not here to sell you a supplement or scare you into a course. This channel exists to give you the science a 12-minute appointment never has time to cover. Nothing here replaces your own doctor. All of it is designed to make your next visit with them far more useful than the last one. And the stakes are not abstract. When inflammation goes unrecognized in the hands, the damage it does to the joint lining is not the kind that reverses, and the things it takes first are the small ones. The jar lid, the buttons on your shirt, the key in your own front door. When it settles into the shoulders and hips, it takes the bigger ones. Rising from a chair without pushing with your arms, lifting a bag onto the counter, getting yourself out of a car. So before we go on, do something for me. Put your age and your town in the comments, and next to it, put one number. How many minutes your stiffness lasted this morning. Please do not skip this next section. It is the key to everything that follows. Every joint in your body is lined with a thin membrane called the synovium. Think of it as the wallpaper inside the joint. Its job is to make a small amount of slippery fluid, about a teaspoon in a joint the size of a knee, and that fluid is what lets the surfaces glide. When something irritates that lining, it does what any irritated lining does. It swells, it thickens, it makes more fluid than the joint has room to hold. Here is the way to picture it. Think of a door hinge in an old house. Wear and tear arthritis is a hinge with the paint worn off the metal. It grinds, it complains under load, and it complains more the more you use it. Inflammation is something completely different. Inflammation is somebody packing that hinge with cold grease overnight. In the morning, the door will barely move. Then, as you work it back and forth, the grease warms and the door swings free again. That is the tell. Wear and tear gets worse as the day goes on. Inflammation gets better as the day goes on. And the number of minutes it takes to warm that hinge is the measurement. If this is already making sense to you, if you just recognized your own morning in that hinge, tap the like button. It is the only thing that puts this in front of the next person who has been told it is just age. Number 5, a warm shower before your feet touch the floor, not after breakfast, not once you have shuffled to the kitchen and back. Before the first step of the day, go back to the hinge. Cold grease is thick and it resists. Warm grease is thin and it flows. Heat does exactly that to the fluid inside a joint and to the tissue around it. It does not remove the grease. It changes how the grease behaves for about the next 30 minutes, and that 30 minutes is a window you can use. I want to be straight with you about what heat is and is not. Reviews of heat therapy in inflammatory arthritis have consistently found that it does not change the disease itself, but that people reliably report they move better and hurt less. So heat is comfort and it is access. It is not treatment. That distinction matters. And it is why this is number 5 and not number 1. Here is the protocol. A warm shower, 10 minutes, water no hotter than 40 degrees Celsius, which is about 104 Fahrenheit. If a shower first thing is not realistic, use a heating pad instead. 15 minutes on the shoulders and hips while you are still lying down, on the low setting, with a towel between the pad and your skin. Do it every morning, not only on the bad mornings, because the good mornings are what you are protecting. If 10 minutes is not enough, go to 15 minutes. Do not go hotter. And here is the error almost everybody makes. They use heat after they have already fought their way out of bed and down the hall. The entire value of it is in doing it before you put weight through a stiff joint. Now the safety, because this is where seniors get hurt. Use a shower chair and a grab bar, or skip the shower entirely and do the heating pad in bed. Test the water with your forearm, never your hand, because skin sensation fades with age and neuropathy will let you burn without feeling it. And understand this one, hot water widens your blood vessels and drops your blood pressure. If you take blood pressure medication, that can make you lightheaded the moment you stand. Do not change your medication over this. Talk to your doctor before changing anything. Your stop condition is simple. Lightheaded means sit down immediately on the shower chair or the toilet lid, not walk it off. And redness that is not faded 20 minutes after the pad comes off means the pad was too hot. Pair this with number 4 and pair it in that order. Heat first, movement second. Heat on its own opens a window and then closes it again while you are still lying there. The heat is the key. Number 4 is walking through the door, because here is what heat cannot do. Heat softens the grease. It does not move the hinge. And the most dangerous 90 seconds of your entire day are the ones right after that shower when a stiff joint meets a cold floor and your full body weight for the very first time. Number 4, 10 controlled joint movements while you are still lying in bed before your feet touch the floor. Here is the mechanism, and it surprises people. The fluid inside your joints has no pump. Your heart does not push it. The only thing that moves it is you. And the cartilage on the joint surface has no blood supply at all. It feeds itself by being squeezed and released over and over like a sponge in a sink. Squeeze it, let go, and it draws fluid in. Leave it still for 8 hours, and it is a dry sponge sitting in a dry sink. Movement is not what you do after the joint is ready. Movement is what makes the joint ready. Rehabilitation programs for inflammatory arthritis build unloaded range of motion in at the start of the day for exactly this reason. And the principle is not controversial. Move it before you load it. Here is the protocol. All of this happens flat on your back before you sit up. Ankles first, 10 slow circles each direction on each foot, then point and flex 10 times. Knees next, slide one heel up toward your backside and back down, 10 on each leg. Hips, bring one knee toward your chest, hold it 5 seconds, 5 on each side. Hands, make a slow fist and open it completely, 10 times, then touch your thumb to each fingertip and go through twice. Shoulders last, arms at your sides, shrug up and roll them back 10 times. The whole set takes about 3 minutes. Do it every single morning. If your hands are the worst part, run the hand set twice. And the error, again, is speed. Fast repetitions do nothing here. Count 3 seconds in each direction because slow and full is the entire point. The safety is built into the design. You are lying down, so your fall risk during this is 0, and that is deliberate. If you cannot lie flat because of breathing or reflux, prop yourself on pillows or sit on the edge of the bed with both hands planted on the mattress. Never force a joint that will not open. You want the range you own, not the range you can take. And the stop condition is the same one that governs everything on this channel. A dull stretch is fine. Sharp pain means stop, not push through. Sharp, electric, or shooting means stop and tell your doctor about it. Now hold on, because there is something strange about all of this. If 8 hours of stillness does that to a joint, then the morning is not really about the morning at all. Watch what happens at 3 in the afternoon. That is number 3. And keep that word, morning, in the back of your mind while we go. Because number 1 is going to ask you to measure it, and by then you will understand why that one measurement is worth more than everything else on this list combined. Number 3, stand up and move every hour that you are awake. Not every 2 hours, every single hour. Doctors have a name for what you feel after sitting still through a long film or a church service. They call it gelling. And the important thing about gelling is what it proves. Your hinge does not own a calendar. It has no idea it is morning. All it knows is that it has not moved. 8 hours of sleep produces it, and so does 80 minutes in an armchair. Think of a road at 4 in the morning. Nothing is wrong with the road. Nothing is moving on it. And that is the whole problem. Here is the protocol. Set a timer for 1 hour. When it goes off, you stand up and you give it 90 seconds. 10 heel raises holding the kitchen counter. 10 slow arm circles. Then walk to another room and walk back. That is it. 90 seconds, 10 to 12 times across a waking day. Once the 90 seconds stops requiring thought, add 5 sit-to-stands from a dining chair. And here is the error that undoes the whole thing. People wait until they feel stiff. By the time you feel it, the grease has already gone cold. The timer exists precisely because the feeling arrives too late to be useful. So set it for the places that catch you: church, long car journeys, and, with some irony, the waiting room at the doctor's office. For safety, both hands go on the counter or the back of a solid chair for the heel raises, and the chair goes against a wall so it cannot slide. If 90 seconds standing is too much today, do it seated. 10 ankle pumps and 10 arm circles from the chair count. Do not chase the number at the cost of your balance. And the stop condition holds. Dizzy means sit down, not steady yourself, and carry on. Pair this with number 4, and notice that I have given you almost the same movements twice. That is not an accident. The bed set and the hourly set are the same instruction delivered to a body in 2 different states. One teaches the joint how to start. The other refuses to let it stop. But movement is free, and free is the clue. Movement cannot repair what movement did not cause. There is a system underneath all of this that you are either feeding or starving, and number 2 is where most people over 65 are quietly losing ground without ever being told, and I will say it plainly now. Neither of these 2 touches the single thing on this list that matters most. Number 1 is still ahead of us, and it is the reason I made this video at all. Number 2, 25 to 30 grams of protein at breakfast and 2 portions of oily fish a week. Here is why this belongs on a list about stiffness. Inflammation is not just uncomfortable, it is catabolic, which is a long word for a simple fact. It burns muscle. And an older body is already resisting the signal to build muscle back. So inflammation is pulling on a rope that age has already loosened. Now think about what muscle actually does for a joint. It is not decoration. It is the suspension on a car. Good suspension takes the pothole and the frame never feels it. Worn suspension and every pothole goes straight through the frame. Lose the muscle around a stiff knee, and that knee stops being cushioned and starts being loaded every single step. The numbers here are well established. International expert groups on protein and aging recommend 1 to 1.2 grams of protein per kilogram of body weight per day for older adults, and more than that during illness. And on oily fish, meta-analyses in inflammatory arthritis have consistently shown a modest benefit in symptoms and stiffness. Modest is the honest word. Modest and real. So here is the protocol. 25 to 30 grams of protein inside 45 minutes of waking at breakfast, because breakfast is where older adults are most short. What does that look like on a plate? 3 eggs is about 19 grams, so 3 eggs and a glass of milk gets you there. Or a cup of Greek yogurt, about 20 grams, with a handful of almonds. or 100 grams of tinned salmon, which is about 24 grams and does the fish job at the same time. Across the whole day, aim for that 1 to 1.2 grams per kilogram. For a 70 kilogram person, that is 70 to 84 grams, spread across 3 meals, not stacked into dinner. Oily fish, 2 portions a week, about 140 grams each. Salmon, mackerel, sardines. And the error is the one almost every household makes. Toast and tea is about 6 grams. You cannot make it up at dinner because the body does not bank it overnight. Now, the safety, and this one is not optional. If you have chronic kidney disease, your protein target is set by your doctor and not by a video. That is a real limit, and it applies to some of you watching. If you take a blood thinner such as warfarin, high-dose fish oil capsules can add to the effect. Do not start a supplement to fix this. Get it from food and talk to your doctor before changing anything. Pair this with number 3 because protein without load is a delivery with no address. The hourly sit-to-stands are the signal that tells your body where to send it. But here is the honest truth about everything I have given you so far. Heat, movement, the hourly timer, the protein. Every one of them is good, and every one of them will make your mornings easier. And not a single one of them changes what is happening inside that joint lining, if what is happening in there is inflammation. They manage the symptom, they do not answer the question. Number 1 is the question. Number 1, time your stiffness in minutes with an actual clock for 14 days and take that number to your doctor. That is it. That is the one almost nobody talks about. Here is why a number beats everything else you could bring. Your doctor cannot see inflammation from the doorway. Blood tests help enormously, but they are not perfect. Inflammatory markers can sit inside the normal range early on, and rheumatoid factor turns up positive in plenty of perfectly healthy older people. Meanwhile, the duration of your morning stiffness is one of the very few pieces of evidence in this entire picture that only you can collect. It happens at 6 in the morning in your bedroom with nobody else in the room. No appointment ever witnesses it. Picture the water meter outside your house. Nobody can tell you whether you have a leak by standing in your garden and looking at it. But the meter, read twice at the same hour with everything turned off, tells them in 30 seconds, your stiffness clock is the meter. My hands are stiff in the mornings is the garden. Under 30 minutes, easing as you move, worse later in the day after you have used the joint. That pattern points toward wear and tear. Over 30 minutes, and especially over 45 in both hands or both shoulders, getting steadily better as the day goes on. That pattern is what makes a rheumatologist sit up in their chair. It is not a diagnosis. It is the sentence that gets you the blood test. The criteria are real and you can look them up. In the classification criteria for Polymyalgia Rheumatica, published jointly by the European and American Rheumatology Societies in 2012, morning stiffness lasting more than 45 minutes is one of the scored items. Age over 50 is another. Aching in both shoulders is another. And in rheumatoid arthritis, European guidance is that a person with persistent joint swelling should be seen by a specialist within 6 weeks of symptoms starting, because the evidence on early treatment is consistent and it is not subtle. The joint damage that inflammation does is not the kind that reverses. What you protect by arriving early. So here is the protocol, and it costs nothing. You need a piece of paper and a clock. Every morning for 14 days, you write 2 times. The minute you woke and the minute you could open and close your hand completely or lift your arm to a high shelf without it feeling stiff. The difference between them is your number. Write the number, not a word. Bad is not evidence. 70 minutes is evidence. Next to it, write 3 more things. Which joints, both sides or one side, and whether it got better or worse as the day went on. 14 days. Because one morning is a story and 14 mornings is a pattern. Do not change your medication to run this test. If you take ibuprofen or naproxen, keep taking exactly what you take, but write down what you took and when, because your doctor needs to know whether that number was measured with the anti-inflammatory or without it. On day 15, you book the appointment and you open with one sentence. For the last 14 days, my morning stiffness has averaged this many minutes in both hands, and it improves as the day goes on. Then ask for the inflammation blood tests by name. On the form, they are called ESR and CRP. And if your hands or shoulders are involved, ask whether an anti-CCP antibody test is appropriate for you. That whole appointment takes 90 seconds. 12 minutes is plenty of time if the first 90 seconds are that good. Now the part you cannot skip, and the real reason this sits at number 1. There are symptoms that do not wait 14 days. Stop the test and get seen the same day if any of these turn up. A new headache you have never had before, especially at the temple, pain or tiredness in your jaw when you are chewing, a scalp so tender that brushing your hair hurts, and above everything else, any change in your vision, blurring, double vision, or a curtain coming across one eye. Those can be signs of giant cell arteritis, which travels alongside polymyalgia rheumatica in a meaningful share of the people who have it. It inflames the arteries that supply the eye. The vision loss it causes can be permanent, and it can happen quickly. That is not a wait and see. That is same day, urgent, and you tell them you are worried about giant cell arteritis. The same goes for a fever, unexplained weight loss, or a joint that is hot, red, and swollen. Those need a doctor now, not in a fortnight. And the stop condition on the test itself is the simplest one of all. If it gets sharply worse while you are counting, do not finish the count. Go. Pair the clock with the 4 items above it and understand why they belong together. The 4 make your mornings livable while the 14 days run, so you are not just suffering and recording it. And they answer the question your doctor will ask you, which is always, what have you tried? Heat, daily unloaded range of motion, hourly movement, and protein at breakfast is a real answer. It tells them you did the safe work already and that the number in your hand is what was left over after you did. I told you at the start that this one could change how you approach the next 10 years, and I meant that literally. Everything else on this list changes how a morning feels. This one changes what the morning is allowed to become. Because if the answer comes back, wear and tear, you have lost nothing at all. You have 4 good habits and a doctor who now knows your baseline. And if it comes back inflammation, you found it while it was still minutes on a piece of paper, instead of finding it years from now in a hand that will no longer close around a key. Morning stiffness is not just age. Joint damage is not inevitable. And the difference between those two is a number you can start measuring tomorrow. Consider a case that is a composite of a pattern well documented in the rheumatology literature. A 74-year-old woman had been telling her family for about 8 months that her shoulders were just getting old. She could not lift a saucepan onto the top shelf anymore. Getting a cardigan on took her 10 minutes, so she had quietly started buying pullovers to avoid the whole business. She had mentioned it twice at appointments and been told both times to keep moving. What changed was not a treatment. What changed was that her daughter asked her one question: how long? So she wrote it down, 14 mornings, on the back of an envelope she kept by the bed. The numbers came back between 65 and 90 minutes, both shoulders better by lunchtime every single day. She took the envelope to her doctor and opened with that sentence. The blood tests came back with inflammatory markers well above the normal range. Within a week, she had a name for something she had been carrying unnamed for 8 months. The point of that story is not the diagnosis. The point is that 8 months of just getting old were undone by 14 numbers on an envelope, and that the envelope cost nothing. So here is exactly what you do, starting tonight. 5 steps, and every one of them has a number in it. Tonight, put a pen and a piece of paper on your bedside table and write 2 headings on it: woke and loose. That is the entire setup, and it takes 1 minute. Tomorrow morning, before your feet touch the floor, run the 3-minute bed set: 10 ankle circles, 10 heel slides, 10 slow fists, 10 shoulder rolls. Then write your 2 times down. Tomorrow at breakfast, hit 25 to 30 grams of protein inside 45 minutes of waking. 3 eggs and a glass of milk, not toast. This week, set an hourly timer 10 to 12 times a day and give it 90 seconds of standing and moving every time it goes off. Day 15, book the appointment. Open with your average number and ask about ESR, CRP, and whether anti-CCP is appropriate for you. And at any point across those 15 days, a new headache, jaw pain when you chew, a tender scalp, or any change in your vision means you do not finish the test. You go the same day. Think of someone in your life who has been saying for months that their hands are just getting old. And if you are watching this because you are worried about a parent, then understand that you are the one who has to ask the question. She will not ask it herself because she decided a long time ago that it was just age. So you ask it. Send her 14 mornings and an envelope. Tell me in the comments which of these you are starting tonight. Your answers decide exactly what I cover next. And if you want more of the science that a 12-minute appointment never has room for, subscribe. That is the entire reason this channel exists. This video is education, not a diagnosis. Your own doctor knows your history, so bring this list to your next appointment. I'm Judy Vance. Don't forget to subscribe and live longer.